Evelyn Andersen, welcome to the Tick Bootcamp podcast.
Thank you. Thank you for having me.
We are really excited to have you. So, why don't you first introduce yourself to our audience
Mhm.
with describing where you work?
Where I work. So I'm Evie, or Evelyn Andersen. Evie, I own and operate Green Medicine of Wisconsin, and we are a integrative medical office in Oshkosh, Wisconsin. Yes, it's actually a real place. Where we do focus on tick-borne illness, but generally try to be more integrative in our approach, holistic, really wanting to have a dedicated partnership with our patients to invest in wellness even beyond the acute things that they have going on.
All right, so let's tease past some of the kind of PR introduction to Green and give us a little more background on the on your practice and
Sure.
who's the founder of the practice and how did that practice begin to concentrate on treating people who are trying to manage tick-borne illness?
Certainly. So to do that and give you a good background on why green medicine exists, I'll go back to our founder, who is Dr. Kevin Green. He's a cat with 9 lives. He has worked as a microbiologist in a lab. He initially back in that era of his life was seeing spirochetes in his own blood, going in and out of red blood cells. So it sparked, I believe, his interest in Lyme immediately. Wanted to fly planes, and the only way he could fly planes was to become a physician because he wore glasses. So he dedicated to the craft, decided to go to medical school. He did that, graduated, became a flight surgeon in the Air Force for a period of time, and then ultimately ended up in Oshkosh, Wisconsin. And I believe partly that is because we have the largest air show in the world, one year out of or 1 week out of every year. So he decided this is where he wanted to be. He did work for a major healthcare organization in the area. For a period of time, he did run the physician group there and decided he really wanted to just focus on his patients. He was doing acupuncture at the time, integrating that into his practice there. And this was, early 2000s, so very progressive in how he's always approached his practice. Um, when he decided to step down from the role of the administrative uh, running of the physician group, as one does, he got called in for a review, an evaluation, and they said, "Hey, your patients don't utilize the emergency room services. They have the least amount of surgeries. They don't use medications, or at least the least amount compared to your colleagues, and you're losing money for the organization." So, being the wonderful person that he is, um, he wrote his resignation that night and never went back. It was that time he was kind of deciding what he wanted to do, and there is another integrative clinic in our area, or was about 40 minutes from where we live. So he commuted and worked there. It's a tick-borne center as well, or had been at the time. And he learned from that physician, and also, I believe during that transition was training with Dr. Horowitz for a while. About 2 years after he left that other organization in the area, he decided, hey, I want to open my own practice a little bit closer to home. So he opened Green Medicine, which we are in the front of an airport hangar. Everybody always asks, why are you in an airport hangar? And it's because he's a pilot. And the closer you can be to planes as a pilot, the happier you are. So that is why we are here. It is pretty cool of a location. It's a good view for the air show every year. So that is how Green Medicine came to be. And it's always really focused on tick-borne care because it was such a need in the area.
Yeah,
Um,
I mean, I think it's really interesting that it was the failures of the acute care
mhm,
system that resulted in him leaving that practice and
mhm.
opening up a practice that focused on
Patients.
treating people outside of that system, right? And
Mhm,
what the thought that kept running through my head as you were sharing, this your founder's story
mhm.
was that we call our system a healthcare system, but it really isn't. It's a sick care system, right? I
It
mean,
is.
and when you incentivize medical practices to make money based on treating sick people rather than preventing people from being sick, that you're punished.
Yeah, that's a really good point, which leads me into how I got into this practice
So
myself.
before we get into your practice, let's
Hmm.
you join your practice. Let's go into your background.
Yeah.
We need to introduce folks to you and the whole you.
Do you want me
So
to start
that
from the beginning?
Well, I mean, so where did you grow up,
Yeah.
and what was your vision for how you were going to serve the world during your
Hmm.
childhood?
Yeah. So I grew up in Stevens Point, Wisconsin, so central. to the state, about an hour from where I live now. Um, Growing up, I was very much thinking I was going to be a professional ice skater. That was my goal in life. That was my sport. I did it all through elementary school, high school. I taught in college. I coached. But interestingly, it kind of does relate into the Lyme story. When I was really little, I was spending time in Wapaka, which was where my aunt lived. She was watching me, and one of my parents were out of town for a weekend, and this is the epicenter, like the bullseye, so to speak, for Lyme in our area. It is
Yeah.
a very hot area, and my dad picked me up on a Sunday, and I had a fully engorged ear tick on my neck. And I vividly remember him, calling the physician's office the next day, and they're like, "No, that's nothing to be worried about. It's not a big deal. She'll be fine." He's like, "Do you want me to bring it in? Do you want me to bring her in?" And they're like, "Nope." So, we thought nothing of it at the time. I don't have a whole lot of memory, so this is a lot from my parents, what they have told me. But within 2 weeks, I had a full bullseye rash on my chest. I couldn't walk. I was having fevers and just complaining of full body pain. For 2 weeks, my mom would take me into the pediatrician's office, and they would tell her I was making it up. And my mom's like, it's July or June or July, whenever it was. There's no school. Why would she be faking fevers? And how can she fake a rash? So she would take me there every morning. And she said, finally, at the end of this 2 weeks I was going, I said, I'm going to sue you if you don't send me somewhere else. Like, she is not better. She's getting worse. They refuse to do any sort of treatment. So they sent a referral to Marshfield, and within, I think, 2 hours we had an appointment. Like, they said, yeah, come on over. So I ended up going there with my mom, and I remember exactly what I was wearing. And this whole medical team came in to look at this giant bullseye rash on my chest. But I do remember that. And I'm not exactly certain. My mom has a poor memory of the treatment, but I know there was a lot of blood work that we did at the time. And there were antibiotics used, but that was certainly, you know, a vivid core memory that I have. And when you think and reflect about how you got to where you are and what I'm doing now, I do believe that particular event in my life is why I do this. Because would I believe and would I take this seriously? I would like to think that I would as the clinician, but I'm not sure. Because I think that experience, having had it myself, it gives you a different perspective.
Oh, for sure, for sure. I
Hmm.
mean, I can tell you that the very best doctors that we interview on this podcast, and we've interviewed hundreds of doctors, are the doctors who had Lyme themselves.
Yeah.
And in fact, this is at times a very depressing podcast for me.
Hmm.
It's always very sad for me to interview, especially young women, because I'm a father of four daughters,
Hmm.
where I can see someone that reminds me of one of my own children, and they share the tortures of this experience, and it's horrible. It's horrible to listen to, at least for a dad.
Hmm. Hmm.
But then, of course, what's really exciting is so many of you move into the medical community. So many of you become doctors
Hmm.
and medical professionals,
Hmm.
and I believe no one can provide better care for someone who is on the Lyme disease journey than a practitioner who has had Lyme themselves.
Hmm. And I think to that same idea, it's just listening to your patients. Like, that is the foundation of what we do. It's
Yeah, but I don't think it's just sympathy. I mean, I think there are a lot of really good sympathetic doctors, but what we see is, there are times when you have to go slow, and there are
hmm.
some times when you have to be pushed, right? And I think if you haven't been on the journey, you don't really understand
Hmm.
when it's time to slow the roll and when it's time to push. And you're going to need both of
Hmm.
those experiences from a medical coach of some
Hmm.
sort. And I don't think you can be as effective at it if you hadn't been there yourself.
Hmm.
If you
Well,
don't,
maybe not just listening, but I guess believing them and understanding where they're coming from, and like
but can
giving
you
them
really, but,
options for treatment.
but I mean, can you really understand if you haven't been there yourself?
No, definitely not. Even, even so, having done this, like, I don't have the same symptoms, or didn't, that some of my patients experience. And
Right.
that's where this becomes really challenging, is because everybody looks different. Um, I have
For
yet to
sure.
encounter somebody that's the same. It's just,
Well, yeah, no, no. I mean, look, there's a lot of diversity within
hmm
the human population, and there's a great deal of diversity within the combination of bugs that are spit into you. And when you have all of those various permutations, you're going to have as many presentations as there are permutations, right? So
hmm
that's certainly true. But there are a lot of symptoms that are going to be consistent, right? And
hmm
we see those patterns as well. But let's stay with your journey for a moment.
hmm
I do want to bookmark Wisconsin for a moment. So
hmm
let's bookmark that to come back to. But so how was your health during your childhood after this,
You know,
this memorable experience?
looking back, I do believe there were some lingering things that were going on, like a lot of chronic sinus things, stress fractures that were really not explainable by other, other reasons or etiologies. Um, Chronic fatigue in high school. Like I would come home and sleep for 3 hours after getting done with classes, and I literally thought that's what everybody did. Like I thought all my classmates would come home and they would take naps and then get up and do homework or whatever extracurriculars we were doing. Um, so that was my vantage point. And when you sit there, you think that's normal. And I think that's also something that a lot of patients like they know their vantage point is here. And if they've been that way since they've been small, they don't know any different. They think that's how everybody is, so that they think that's a normal experience. And I did do additional treatment coming here with Dr. Green, starting shadowing with him in clinical work, and all of that's pretty much gone. I don't have, I would say the lingering things I have would be a little forearm pain in the fall and like some joint knee and ankles in the spring, and that's about it. Um, but those may be ongoing. I don't know. But they don't keep me, nothing has, it's not kept me from doing anything. And having had those things, I've gravitated towards more of a healthy lifestyle, doing all of the nutritional things, stress reduction, just all the things we all should generally be doing, which are the foundations of health, that are often not even discussed in regular clinics. Those are the things that I focus on. Yeah.
Yeah, we're gonna talk about that, I promise, because
hmm
it's really important to us to take boot camp to talk about lifestyle and
hmm
what we can do to lay a foundation for protecting our immune system or enhancing our immune system. But let me come back to the Wisconsin
Yeah.
mark, right?
Sure.
So, I'm in New York on Long Island.
hmm
We certainly the birthplace of Lyme disease, not from an observational standpoint, but the ticks that were dragged that ultimately were used, became the foundation of determining or discovering, at least publicly discovering,
hmm
and I'm going to get to that in a moment. Dr. Banash here at Stony Brook University was out east of where I live, and he was doing a tick drag, and he found the ticks, and when he was examining them, he saw something that he thought was interesting, and he sent them to Dr. Bergdorfer, who when reviewing these Long Island ticks,
hmm
discovered the bacteria. If you believe that tale, and I call it a tale because I don't believe it,
hmm
especially after reading Chris Newby's book and learning that Dr. Bergdorfer had been a part of the bioweapons research project
A
and
lot of a lot
had
of
been
curious things.
working with ticks. But the reason I'm making this observation is because in reading Chris Newby's book, I
hmm
discovered that the University of Wisconsin was one of the universities that had the largest um, tick lab during the bioweapons research that was being done
hmm
during the World War II era. In
hmm
fact, the bioweapons research project was 3 times larger than the Manhattan Project that produced the atom bomb. So we on Long Island here, call ourselves, in the middle of the Lime Belt, where,
hmm
again, up and down the East Coast, certainly in the tri-state area of New York, Pennsylvania, and Connecticut, we leapfrog each other with the greatest number of Lyme disease diagnoses every year. But one of the things that we always find interesting is how many people are sick from Lyme disease in Wisconsin. right? And the
Hmm.
question is always like, you're all the way over there and we're all the way over here, and why are we all, despite having that distance, what's the explanation for that? So give me your insights into, how prevalent Lyme disease is in Wisconsin, and why would there be this huge gap in land mass between where you folks are and where we are, and all of these Lyme disease diagnoses that are taking place in both places.
Why I think that's the case? I mean, you could think of different things that could be. I mean, there people travel, animals travel,
Yeah,
vectors don't stay in one spot. I mean, you see
true.
geese moving all over the place, people move all over the place. I know for I'm sure there's still vets that say this, but the longest time they're like, oh, Lone Star ticks are just in Texas. I was like, well, really? Because I found one on my dog in my backyard here in Wisconsin. So I don't think
Yeah.
we're in Texas. I think that are you, I'm not sure if you're asking.
No, I mean, like, look, I think, I mean, I may be wrong. I think it proves out the argument that Chris Newby made in Benton that the locations where the bioweapons research was taking place is
Potential,
where
sure.
all because let's say hypothetically that it started on the East Coast and then all the birds flew and the deer roamed and what have you. Well, then why wouldn't there be this whole belt of line from where we are to where you are? Why do we have a large concentration in two places and not in between? I think it, may be right, may be wrong, but I believe it's because there was bioweapons research being
It
taken
very well could
place in
be.
Wisconsin.
I mean, I don't know if we'll ever get a real answer on that.
Oh, I think we will. I think we're getting closer. I'm being told that some of the information that's now being gleaned from the JFK files that were recently released are buttressing a lot
Well,
of
I
the.
will be looking forward to that.
Yeah, we should. So, and
Hmm.
Chris Newby is, just a brilliant, brilliant researcher. She actually just co-hosted with me recently.
Oh, great.
And we had a chance to chat. And yeah, but so how prevalent is Lyme disease in Wisconsin?
I mean, Dr. Green and I joke that we do believe probably everybody has been exposed at some point. And that's the unfortunate truth. And I believe that's very accurate. We have a lot of hunters, a lot of people that spend an enormous time outdoors, especially in the summertime. Um, I have herds of deer running through our backyard. I I I do believe everybody's been exposed. It's just to what degree it's affecting you. What other life things have been at play that have compromised your system, traumas, et cetera, is why it presents in some people and not in others. And I think it's some of those lifestyle pieces that really keep your immune system functional, and that's why it's not symptomatic in everybody, but certainly I do think that there's widespread exposure, if not to everyone.
Well,
Um, and then
so
you have, yeah.
when you're arguing that it's everyone, you mean everyone has been exposed to some or all of the tick diseases that ticks are harboring, but only those people with a compromised immune system are symptomatic?
No, I'd say there usually is like a triggering event. A lot of times that's an emotional triggering event, like a divorce, family member passes away, something really tragic happens, a loss of a job. Pregnancy can be a huge triggering factor because that's an immune compromised state at baseline. So I've seen that happen. Or even just, the pregnancy was fine, but the postpartum period was really challenging, exhaustion, et cetera. And then, kind of this quote, never well since event. You do see that often, but there are some other people that it's more insidious that it happens gradually over time. And I think once you start looking for this, you see it everywhere. You'll see it, I mean, unfortunate as that might be.
Yeah, no, I agree. I agree.
Yeah.
So let's before we take off on that, we'll bookmark that as well. Let's come back to you,
Hmm.
because I want folks to get to know you. So you had this experience during your childhood. You had Lyme disease.
Hmm.
It was thankfully largely an acute presentation.
Hmm.
You lived a very healthy lifestyle. You were an athlete.
Hmm.
You were able to your immune system was able to manage these bugs during most of your life.
Hmm.
So where did this take you? Was it this event that inspired you to move to study the healing sciences and arts, or was there something else?
Well, possibly in a not so direct way, but having had that experience, like generally gravitating towards this healthier lifestyle, my first go round in school or with my bachelor's was in health promotion. So it's a lot of behavior change coaching. A lot of what I did in my previous work was more with corporations, schools, creating programs either for students or employees, really trying to get their health optimized, doing biometric screens, those types of things, interpreting what those results showed, and then seeing what we can do as far as interventions. But unfortunately, with the economy doing what it did in 2008, all those jobs were just eliminated. They didn't exist anymore. So when I was looking at what I really wanted, because I love that teaching piece, I like talking to people, trying to keep them healthy is really the optimal goal. Like trying to keep people optimal is really what I try to do. Um, I looked at jobs I wanted. They wanted nurses, and I was like, "Hey, I can do nursing school." So I applied to UW-Madison. Speaking of your lab, I worked in neurosurgery trauma down there for about 10 years, and it's a level one trauma center. So you do see where the Western model does great. It shines in trauma, emergency medicine. It is where I wouldn't go anywhere else for that kind of situation. But for these things that are unexplainable, chronic, ongoing issues, you can't treat it the same way. It's just it doesn't work. It might work for a short period of time, but over in the long end, it's just not going to work. So being as trauma and working at night as I did as a floor nurse, it's just not very conducive to health, and that was really something that was important to me. I liked the autonomy of working at night. You have a lot more decision making before you call the physician. You have to kind of go through and say like, what can I do on my own? So I enjoyed that and decided, well, I guess I'll go back to NP school. I briefly entertained doing medical school, but with the loans and the time, I pay for this all myself. So it's challenging to say, oh, I'm going to take another few hundred thousand out in loans. So I ended up going to NP school, graduated from that in 2017, and then moved up to Oshkosh because I had met my now husband. He worked up here. He owned a business. He's a pharmacist. So he had met, this is how Dr. Green and I met. He had met Dr. Green's wife and he goes, "Hey, you need to go see this clinic." And I said, "Okay, that sounds good." So I emailed Dr. Green immediately and I heard back from him about 6 months later. And now owning the business myself, I understand why emails are not the best form of communication. But he's like, yeah, come down. I want to shadow anytime. So while I was working in primary care at another larger healthcare facility, I enjoyed that. I didn't have any poor experience there. They let me kind of do more integrative minded things. But I really craved something different outside of the system. And I would shadow here on my days off from my other job. I was off on Wednesdays from my other clinic and I'd just come here and hang out with Dr. Green. And little did I know for the year or so that I was doing that, he was interviewing me this whole time. And he was trying to find somebody to take over the practice. And it really was just a very, you think about the serendipity, like I met him because my husband and I never thought I'd live up here. It just happened. And you have to take that into consideration. Like, did I have this experience as a young kid and that's how I got here? Um,
Well, there's no doubt in my mind. I mean, again, and I don't proselytize, but as a Christian, I do not believe in coincidences.
yeah,
I do believe that everything is happening because it's supposed to happen.
yeah.
And I think what's really cool about your story already, so let's pause here for a moment and highlight this,
Hmm.
is you had your experience in the medical community with Lyme disease.
Hmm.
You then had your initial job in the prevention arena, right?
Yes. Yep.
And the arena where we should be investing money as opposed to and you were truly participating in a healthcare system.
Yes.
And then when the economy tightens up, what we do is we turn
Just get
back
rid of
to
that.
we get rid of those jobs. We contract in the healthcare arena, and we go to the sick care arena, right? And you had no choice but to train in the sick care arena. Thankfully, you had a good experience because Western medicine is unbelievably fantastic in emergency
Yep.
arena and acute care arena, but you now had these sort of the merging of these experiences,
Hmm.
seemingly to parallel the experiences that Dr. Green had in a different arena, and now these two kindred spirits come together, and
Yeah.
both of you see the failures, not just the beauty, but also the warts in the American Western medical system, and you do something about it.
Hmm. What's interesting is about the time Dr. Green left Aurora, I was graduating nursing school, and I remember a friend has like, they knew I was very interested in more preventive care, and they're like, "What do you want to do with this? Like, you don't really want to do nursing the whole time." And I said, "I don't really think what I want to do exists yet." And when, like, just about that time we had that conversation, if the timeline tracks, which I think it does, is right when Dr. Green had left and opened this office.
That's cool.
So it's very cool to have had that just kind of, like you said, a parallel journey that kind of brings you together.
And
But
also you have to prepare, right? I mean, this
hmm
is, God is not going to give you something until you're ready for it. So you have
hmm
to go through all the stresses that cause you to build up physically, emotionally, and spiritually so that you can be worthy of
hmm
receiving the gift that you were given, right?
hmm
And now we have you managing this practice.
hmm Yep, exactly. So that's essentially how I got here. And I remember it was my birthday and weekend in 2019 that we met, and he's like, "Do you want to work for me?" And I was like, "Yeah." It's like I come here for free. I
Mhm.
would certainly like to work here. So there was really no question. I just remember being like, "This is my dream. Like this would be my dream job. I would love nothing more." And since day one coming here, I have I've always treated it as my own clinic. It was always in my mind that's how it was. And so we did exchange ownership. He's still our medical director. He's still here. He comes in. He's coming when we have a new treatment coming in this pretty soon, and he's coming in for a training with us on Thursday. So he's still around, but yeah, that's we exchanged ownership in 23, and so that's that's why we're
Congratulations.
still here.
Congratulations. So let's talk to us about how you what is your treatment protocol? What is your system for treating people who have tick-borne illnesses?
Yeah. So I love to say there's no protocol. I have a general skeleton or guideline that I like to follow with what we do for treatment. But doing this as long as I've done this, I've learned that nothing works the same for everyone. You have to take into account what they're willing to do, what financially they can do, what their schedule allows,
Yeah.
all of these different factors. But we do find probably that our most success has been with a very integrative approach where we
What does that mean? What does integrative mean?
pulling whatever works, in my opinion, and melding it together. I've kind of termed this concrete weaver. Somebody's called me this recently because I seemingly put a lot of things together in a treatment plan that don't you would not necessarily think would go in the same plan. So when we're talking about actual tangible treatments that we write out on a list and have people take, we're looking at herbals, we're looking at peptides, homeopathics. We do IV therapy, we do ozone therapy. We're starting a light treatment here very soon, which we had historically, which has been probably the best treatment we ever had. We do use prescriptive antibiotics, antifungals, HDC therapy, which I don't know if you've ever spoken with Dr. O'Hara, but she's pioneered. That's been very successful in a lot of my younger children that have some neurologic symptoms. But then the other homeopathy has been huge. I should, you know, state that as well. That's been a recent addition. So I'm currently in training for that right now with more of a traditional school. But I found that that has really been effective in dealing with some of the emotional damage that the gaslighting with traditional medical systems has done to our patients. Um, I don't know how to fix sometimes what somebody has had happen to them when they're 10 years old or 5, or the non-belief that they've been, or that people say it's all in your head for so long. Like, but homeopathy has been very, very helpful with that, and very gentle. So the other things we focus on, of course, are going to be nutrition, exercise, sleep, stress management. But honestly, I should mention too, I'm a sports nutritionist. That's been in part of my training and my background because I do think nutrition is a foundation. But more than that, recently, within the past year, I've really been focusing a lot on light biology. And I don't know if you've ever dove into this idea, but I think this is a huge piece of why Lyme and other autoimmune and chronic illness has been so prevalent and exploded in the past 30 years. is because of our technology use. It's been ingrained in our world. The blue light that is emitted from the screen we're talking on right now, which is why I have these glasses on to protect my eyes, actually changes the chemistry of your brain. So when you're changing the brain chemistry and all of these other hormones, it affects your immune system, I believe. And so I do think that there are things we can do to lever the light in our world, both native, meaning outside, and non-native, meaning inside, to really heighten wellness and immune status generally. So
Okay. So you
that's a
said
lot.
we said we know we're gonna unpack all of it.
Uh-huh.
I wanted you to be able to share all that. Let's talk about the we. It seems like there are a lot of female we's at your clinic. So talk to
We
us
do.
about your staff.
I have a great, yes, I've got a fantastic staff. So I'll start with, obviously there's myself and then my practice manager who I share an office with, she's Kate. She's like my right hand. If I need her to research something, if I need her to, I don't know, order something for me, if I need her to find pricing on something, she does it for me. She schedules all our new patient appointments. She does all our pre-screens, sends out our patient packets for scheduling. She knows how to do everything in this office. She's probably more important to the office than I am at some point. And then we also have our nursing staff. We only hire registered nurses here because we do so much education. There's so much triage over the phone. We have a phone tree, so you get to the nurses, but there is no automation in the traditional sense of, leave a message, et cetera. Sometimes if they're busy, but we try to make sure there's 3 nurses on staff every day. So when the patients call in asking about questions with treatment, um, they're getting a live person to talk with them. We say there's a 2-day turnaround. They almost always get called back within an hour, if not by the end of the day, for sure. But we have my nurse Susan, we have Rhonda, we have Jamie, Ashley, and those are our nursing staff right now. So they do all of my IVs, they do all my blood work, they do my lab draws, they do my patient teaching, they do packaging of orders, all the stuff. I also have a receptionist, Joanne, who answers, she's the best too, does all our check-ins for patients over the phone if we have virtual visits. And then Patty, she does all the ordering of any herbal supplements, all the products we carry in the office. So,
Oh,
yes.
so now let's talk about a person who now comes to your office and you accept them as a patient,
Hmm.
and they have a previous Lyme disease diagnosis.
Yeah.
What will you begin to do to now assess the needs of a new patient?
Hmm. Somebody with a previous diagnosis, of course, I want to get all their records. So previous to them even coming in this building, Kate is very instrumental in reaching out to all their other clinics, getting any sort of data that we can, because if we can avoid repeating testing, that may be unnecessary. We try to use what they've already had done. A lot of times I'll find people have had a plethora of gut testing and et cetera, just thousands of dollars, and there hasn't been a whole lot of actionable steps taken from that. So we try to utilize what they've already had, and can we do something with that, or is this really just not part of what we're dealing with now? The initial appointment, we only take 2 new patients a week. It's just all my brain can handle, and I want to make sure I'm sharp for everybody coming in. Um, that takes place on Tuesdays and Thursdays. So you arrive about 10, they do their full check-in, the nurses go through all their medications, do their blood pressure, pub vitals, lying, standing, those just normal biometric points. And then we start our appointment about 10:15. And the time with me we go is 2 hours. So in that time, we review everything, like percentage of how they feel today. Why don't they feel well? When's the last time they felt well? We go through their childhood. Sometimes birth is required in that conversation. Pregnancy how the mom was doing. We go through all their medical history, surgical history, family history, social history, and then of course a complete head to toe of symptoms, what they are today, what makes it better, what makes it worse, all of those things. And then once we finish our appointment, typically labs are done if that's necessary. We do have some routine things we like to check. Um, and then I will most often have a treatment plan that day, assuming somebody is ready to start. I occasionally have patients, and talking about a previous Lyme diagnosis patient that, maybe is not completely sold. They want to wait for their blood work. They want to wait to comprehensively review that at our second appointment before they would start anything. I have had people do that even with an established diagnosis. So it really depends. That can, like we talked about previously with all those other treatment options, really range for depending on what the symptoms are and what we're targeting first and what's priority for that patient. And then after that is all established, they sit with my nursing staff for as long as they need. Sometimes it's a half hour, sometimes it's 3.5 hours. So really, they do a lot of the education. They do all of the education at that appointment.
Okay, before we get to the education, let me ask you about the work that you've now done with the patient. You
Sure.
you you described a very extensive background interview that you conduct,
Hmm.
going all the way back to birth, you said in some
Yeah.
patients. Why is that significant, in particular with a Lyme patient?
Because what I'm looking for is any established patterns of chronic illness earlier, or what kind of emotional things. Is there any history of trauma in the family?
And why is that
Whether
significant?
Because I think that definitely compromises the immune system, and that could be that initial piece, that initial instigating event as to why this started to devolve, especially in somebody so young. If it's a younger patient, child, they don't always have the language to articulate those things. So that is something that I find important to kind of really dig into that history.
During an interview that we conducted with Dr. Horowitz,
Hmm.
by the way, we'll be actually interviewing him next week, so folks will be
Hmm.
hearing from him again on our platform. He shared with me that 1 in 3 of his female patients had been the victim of sexual abuse
Mm.
during the course of her lifetime prior to contracting Lyme and prior to making it to his office. Are you finding similar experiences with your patients when you're conducting your background interviews?
I would say certainly there are female patients that have had that in their history. Can I say it's 1 in 3? I'm not sure if I can give you that strong of a statistic, but I do think that there are things very damaging that have happened to children that do support what he's saying. Um, or even, it doesn't need to be just children, it could be, adult women as well.
Yeah, it could be,
Um,
and I don't think he limited it to children. I think
mhm.
there's a whole range of events that could result in a conclusion of sexual abuse,
Oh, sure.
again, I was struck by that statistic. It
That's
just
a
seemed,
disturbing statistic,
yeah.
first of all. But I would say I mean, if that's what he's seeing in clinic, I believe it. I don't think he would, that's not something you would want to elaborate or conflate.
Yeah, no, for sure.
Hmm.
So you're looking for trauma, whether it be sexual trauma or any other type of trauma, even a traumatic birth, because you've come to the conclusion that trauma will be immunosuppressive, and that's something that you're going to take into account when determining
Hmm.
how to treat this patient or
Hmm.
what you're going to set up in the treatment plan. So give me a contrast between somebody who has had a traumatic experience during their lifetime prior
Hmm.
to coming to you versus somebody who has not suffered from a traumatic experience. How would the treatment plan differ?
So certainly something that I want to make sure, this actually happened today. I had a young man come in, and there's been reports of abuse when he was a kid from parents, physical abuse. Um, and that's an environment that should be very, very safe. When you're a young child, like, you shouldn't have to be worried about the people that are taking care of you doing any sort of harm. Um, what I am very concerned about when we have that in the history is I want to make sure that they have a mental health professional on their team, because that is not my specialty. And they might not require any sort of medication or counseling, but if that comes to it, if we need somebody with that specialty, I want to make sure that they're available to them. So that's a really, really important thing. That sometimes it might be that we don't start a very aggressive treatment plan, because you can stir up some of those anxiety, those symptoms, there's neuro symptoms, depression, those types of things that can be very disruptive to a person's daily life. And what I want to make sure is we're supporting them as best we can. Not everybody with Lyme needs a counselor or mental health care team, but in those instances where there is that history, I really like to make sure that's at least been explored in some capacity. So we
I'd,
did with
I'd,
them.
I'd, I'd probably debate you on that. In fact, I will debate you on that. We actually argue that everyone with Lyme disease needs a mental
Mm-hmm.
health professional on their team,
Mm-hmm.
and not only because they may have been the victim of some trauma during the course of
Mm-hmm.
their lives leading up to the experience, but Lyme disease itself is traumatic. The way the
Sure.
medical community treats people who come in with Lyme symptoms, no less
Mm-hmm.
than Lyme diagnosis, is traumatic.
Mm-hmm.
The financial challenges that are associated with Lyme disease are traumatic. The
Mm-hmm.
losses that you have, social losses, whether they be friends or family, jobs, or other social traumas are just, are a part of this experience. And I do think that the neural pathway challenge changes that occur as a result of just the trauma of Lyme are going to be something you're going to need to overcome.
Mm-hmm.
And I think having a mental health professional on board is vital.
Mm-hmm. I mean, that's absolutely a valid point. But there are patients that are not going to want to see somebody. So if we have that conversation and somebody is very much against, it could be that or any other treatment. I mean, they're their own person. I will respect that, and I do my best too.
For sure.
Yeah.
For sure. I agree. So I
But
see.
I do agree. I would say the level of PTSD and anxiety I see provoked from having gone through this experience as it is extreme
Yeah.
and very damaging from
So you,
multiple different ways.
So you've completed your social psychological background interview.
Mm-hmm.
You've now come up with a treatment plan. Now you indicated that you're going to send your patient for testing. What type of testing are you going to send them for? And will that include Lyme disease testing?
Depends. If they've had it already, um, maybe. Depends what that looks like. We have that conversation. If somebody has previously responded to treatment, maybe had a relapse or a known tick bite with a migraines rash, those are patients that you know, the bullseye rash by itself is clinically diagnostic. If we have documentation, I don't need to repeat testing in those patients. That's a little bit of a waste of resource, in my opinion. The CDC, by its own admission, was stating a history of exposure to Lyme, chronic signs or classic signs and symptoms. Those are diagnostic criteria. Testing is useful if used correctly, and most of the time it's not. We do look at an immune marker, an inflammatory markers, multiple inflammatory markers. I do a very thorough advanced blood chemistry and looking at not only what we would consider out of range markers by clinical labs, but more what are we looking at my optimal range. So I have a whole different spreadsheet I use that's based on literature, looking at predictions of disease process or other more insidious things. Because what I always want to make sure, and I feel very valid, I want to make it very clear to the patient that I don't think you have anything else more insidious, more concerning going on, that this is what we're dealing with, and we have the green light to just proceed with our treatment as we have planned. So I really want to make sure that we're not missing anything else. And that's why we proceed with a pretty comprehensive plan.
Okay.
Mhm.
So I love it. It's good stuff. So let's focus on the Lyme disease testing
Mhm.
for a moment, then we'll talk about the other testing.
Mhm.
So the tease out for me when you're going to recommend Lyme disease testing versus not, and when you
Yeah.
are recommending Lyme disease testing, what tests do you recommend that patients use?
Mhm. So when I would recommend the testing is typically a new patient that hasn't had it before without a history of a tick bite or a rash. Those are the patients that I generally say we are going to do this day one. That's our first step. Of course, if they decline, I usually don't have people decline that because they're already here knowing that that's something that they want to be tested for.
Mhm.
Even if they've had it done elsewhere, of course, you are probably well aware there aren't many labs that test for this properly, and we do use IGeneX. We actually have a relationship with a large teaching hospital out in Illinois who we have partnered with that they do run some people's insurance for their labs. If it's a national plan and it's covered by their plan, the majority of their blood work will be covered, and that includes that IGeneX testing, which is fabulous because we've been able to run much larger panels on some of our patients looking for the more of the co-infections, and I'm not saying that because they're less important, they're just existing at the same time. Um, that can give more clarity as to maybe what this patient has. What I always put a asterisk by with that is that even if your testing comes back negative, it doesn't mean you don't have it. It means we don't have one of the strains we're testing for. The last research I looked at with Bartonella specifically was 85 different subspecies, and I can't remember exactly how many are onigenics. Babesia has over 100. Borrelia, we're looking at 100 in the US and 300 documented worldwide. So, if we don't have the testing to test for it, we're not going to find it. So,
Right, and also it also depends on whether or not there are antibodies at that time
hmm
to locate, right? So I
right.
mean, you could have the disease and just not have
Well, depending if you test too early, if somebody was given, say, like you were saying you had called the one-time dose of doxy, that actually makes the testing more likely to be negative
right.
long term. So that's, these are all added challenges, but we do it because, if we can get a patient that positive testing, not a lot of insurance companies do cover, but in the future, if they do, we have that already documented and we have
Right.
that black and white.
Yeah.
Although people will argue that sometimes they're not
So I
positive
mean,
when they
even
are.
even with a even with the rash, and we know that in most cases there is not a rash, and certainly not
Oh,
not
no, yeah.
bullseye rash. But even when you do have a rash and you have a bullseye rash, doesn't it make sense to test anyway? Because isn't the bullseye rash just suggesting that there's a strain of Borrelia and that there obviously Lyme disease is going to be polymicrobial?
You're saying why should you test anyway?
Yeah, I mean, I'm arguing that you should test because I think the rash is just indicating one strain of one microbe, and Lyme disease is polymicrobial.
For sure. But you could be also missing, it could be one of the 80 some other ones that we don't have testing for. So
Right, right,
I generally, because of the cost of these tests, do leave it up to the patient.
right.
If we have documentation, we have that discussion and it's totally, I've had people opt both ways. Like they'll say, yes, I want to do it. No, I don't. And if they've had the classic signs, symptoms, all the things we already talked about, I will honor that and defer it if that's what they choose. So
Okay, so now,
I would never tell somebody, oh, you've had a rash, we don't need to test.
so
If they
now,
want to test, we will.
so you as a clinician now come to the conclusion that your patient has Lyme disease,
hmm
either because of a positive test from IGeneX or some other reputable lab that you might be working with, or someone else might have worked with, and or clinically, you come to the conclusion that they have Lyme disease, regardless of whether they've had a rash.
hmm
What's the next step?
Well, as I mentioned before, when we do, are you talking about at that initial visit?
No, no, we're past the initial visit. You've had your initial visit. You've done your your social psychological analysis. You have all of the background information.
hmm
You've now sent them for testing. You have all of your test results in. You now one of the test results you have in, or based on the totality of the
Yes.
of the
So
tools that you're using, including your clinical tools, you come to the conclusion that someone had Lyme disease.
So we do have that 6 week follow-up after the initial appointment because we get all of, some of the labs do take about 4 to 6 weeks to return.
Okay.
So we want to make sure we have everything at that time and we go, unless there is something emergent that I want somebody to change or it does require them to go in an emergency fashion to say the ER, I certainly don't always call with results immediately unless their IGeneX, of course, is positive. Um, but we review all of that at their second appointment in depth. I make sure that we understand what we're doing, why we're doing it, how the treatment has gone so far. So that 6 week follow-up just allow us to see like, did you have a response, good, bad, or neutral? Are you seeing improvement? Are you seeing something worse? Really going through, we do a checklist. I'm sure if you're familiar with Horowitz, it's his scale that we do at every appointment. We utilize that because people will forget, if things get better, they forget they had something. So we review that and then follow-ups after that are every 6 to 8, well, it could be most likely 8 to 12 weeks, depending on what treatment we have and what monitoring is required. There will be additional labs depending on prescriptions that we might be on for monitoring for kidney, liver function. But yeah, that's
So you indicated
routine.
that after you do your work with them at the initial appointment,
hmm
you then have them meet with your nursing staff
Yep.
with the educational elements of the work. You said in some cases an hour, in some cases it could be 3 or more hours.
Whatever the patient needs. Yep.
All right. So what is it that your staff is providing the patient from an educational standpoint?
So we still use pen and paper here. So they have a written out list, usually in a very specified order of what I want to start, when I want them to start it. Sometimes that's foundational supplements that we're looking at for more of a cellular health support. Some of that will change once we get their blood work back, depending, something might be eliminated and something might be added, depending on if there's deficiencies that are noted. With further down, we would consider that active treatment. So we'd be looking at either the herbals, the peptides, antimicrobials of whatever fashion. If we might have recommended IV therapy, do we recommend they do lymphatic massage here? That's another thing we offer for more of that detox support. They would go through that specifically one by one. This is how you add it in. This is you take it. This is the time you take it. This is what can be taken together, what can be taken away from food. They're very detailed and they'll write up what we kind of describe as a menu of what times we're doing what and how often. Do you continue this? Do you do one bottle of this, etc.? So they try to be very detailed with explaining that.
Still going to jump in here real quick. So
Sure.
you mentioned a lot of different things, and I'm going to kind of jump into them a little bit in a more detailed manner. So if we can
Sure.
focus on the herbals, because I like that you do IV therapies, peptides, herbals, lymph, because you're really doing a whole body approach, detox, antimicrobials, immune supportive, cellular health supportive, which is excellent. And from our experience, has been the most effective way to combat a chronic illness and this, multi-systemic polymicrobial disease. So from the herbal standpoint, what specifically do you like? And at Tick Boot Camp, don't be shy. You can tell us brands you recommend, right?
Sure.
Like what specific brand, who makes the herb? We want to hear because our listeners want to know exactly what you like and what you recommend and what it's used for.
For sure. So depends a little bit. We kind of take into account, like, do they need timing? Do they have timing restrictions? So are they a mom of 5 that only has 10 minutes in the morning? That would be something that I would try to make sure that we don't need a lot of spacing in between. I'm sure you've heard of these Byron Whites. We use those quite often. They're very nuclear powered. I love them. I was really getting nervous when they had their mudslide issue a few months ago and we're having trouble shipping everything out. That was getting a little hairy, but that's a fantastic. I will say that I often do one of the 3 big ones that I considered for Lyme, like the AL complex, the ABAB, the ABART. I kind of bookend that, meaning that's the first thing we put people on a lot of the times, the last thing we take off. At the end of treatment, sometimes we will preface that with doing detoxification with some homeopathics. Itaries and Renalex is really fantastic. We use a lot of Nutrimetics products. Depending on if somebody needs to have everything taken at once, that's sometimes a really good option because all of those products can be combined. Biocidin is awesome. I have used that a lot of times in combination with prescriptions because it actually encapsulates or closes this efflux pump on the cell wall that keeps the antibiotics working a little bit more effectively. Um, Aqualorin, I don't know if you've come across that too much. That's a newer
No.
one for biofilm solution. It's fabulous. It's a coconut oil derivative.
Can you spell it? I'm sorry.
Yeah.
We've never heard that one before.
Aqua, like AQUA, like water.
Yep.
Laurin, Laurin. So have you heard of lauricidin?
Yep.
So it's like that, except it's water soluble. So it is got the same concentration of breast milk, but it's amazing for dissolving biofilms. Very strong. So we start people at a titration where we do a nasal spray or an oral spray. Once they graduate and they're doing well with that, we graduate them to more of a water mixture. And then they would start taking it directly off of 1/8 of a teaspoon. But I don't recommend doing that right away because that can be, depending on what somebody's got going on, it can be very challenging for die off.
So when you said that you like Byron White, because I think you said because they're nuclear, can you explain what that means? I didn't fully understand that.
I'm just saying they're extremely strong. Very.
Oh, okay. Got it. I'm like, what does that mean,
Not,
nuclear? I've never heard
they're
that
not
either.
nuclear weapons. In my experience, people respond really, really well to them. And sometimes at very low doses. So
Got it.
we have again, that's part of the thing. We have a full 15-day or 20-day plan. I forget exactly. We have a max dose that we would have somebody try to reach on those because just for the sake of making sure we get effectiveness of the product, but not use too much. But we have, if they start to have a response, a herx, a die off, a healing episode, what we like to term it as more of a herx. People are more familiar, but we really term it as a healing response. We have them back down and then just stay at a lower dose. So it's very individual titratable.
Got it. So you gave us a lot of things like the, Byron White AL complex, a BART, which we've heard before, right? And those are very much targeted antimicrobials. The Nutrimetics, we love Nutrimetics as well, biocidin and aqualorin, which we've learned about for the biofilm. But what are some herbs you recommend purely from a supportive standpoint, a less antimicrobial standpoint, to help it aid in detox, potentially mold, mycotoxins, heavy metals, or just detox and die off of bacteria
So
and aid in that piece,
So, I mean, we use a lot of chlorella, Berber panella. What are you smiling? What's
Anybody who listens to this podcast knows why I'm smiling. So if Richard didn't share with you before I hopped on, we love Dr. Rolls. We've been like groupies of his for quite a while. So we've tried almost, I think, every single one of his products. And chlorella is my absolute favorite. And Rich hates it because, and this is TMI, and I know, but there's no such thing as TMI on the podcast. Rich took like one or two, and Rich was had to cancel all of his appointments in the office and was in the bathroom all morning and never took it again and hated me for it. And I love it. I think it's the best thing in the world. So
well, that's where, we're really talking about this individual response, right? So like
yes.
how you respond and how you respond are very, very different. And obviously, if that's what I'm going to require Rich to take, he's going to not come back. So
yeah.
we have to have other.
Certainly did not come back. Yes.
We would have to have other options.
If I came back, I'd be in your bathroom the entire
time. So you're talking more just from like a general detox. I use a lot of homeopathics for that purpose. Yep. And again, because I find that some people can't tolerate I kind of think about it as like pushing on the gas pedal too hard. Like we have to calm your system down. We have to keep everything moving in a very, I don't know, calm fashion. So if we can energetically prime somebody to be able to accept this treatment, I found that's the ticket. Like if we can calm things down, then start to push, I can test them out, and I got to learn kind of their flavor. I have to figure out how aggressive can I be? And sometimes I'm surprised. Sometimes my really, really symptomatic people, like no problem. They just plow through, and it's sometimes the ones that I feel like are more constitutionally robust that do have that challenge. So we kind of approach with caution, but educate and educate and educate on what people should do. And that's why we have the nurses here for people to call.
But I do think that like chlorella, okay, try and see how you react, and we're going to be different, right? And I absolutely love it. It helps me not to be too gross, but more regular, right? And just from exercise, but taking chlorella, taking other things, I just feel like I'm just really primed, And again, everybody's different. But Berber panella seems to be one that I don't think I've ever heard of anybody say.
Really?
Berber, no, but we've heard of it a lot. But I've never heard anybody say Berber panella has caused them to have a flare or a herx. I've only heard people say that it's like it's been helpful in reducing
I would say
I've
had one person say they can't do it. I can't exactly remember the situation. I wish I could at the moment, but they were just like, nope, it doesn't. Nope, I can't take that. So that has happened one time.
Yeah, but I think this is something that maybe it's a lower risk, inflammatory or I say triggering tool that will help reduce inflammation and will help you make your body be able to detox better. And it's something people can take at the early stages and throughout to have less of a flare while treating and getting themselves better. That's what I'm really trying to frame here,
We use that all the time, like all day long. Like I don't have a
medics, right?
Yep. So I let people use that fairly liberal. We do acute dosing, like 20 drops in a shot glass every 15 minutes if you need it.
Wow, every 15 minutes?
Sometimes, depending on how aggressive we need to be. Otherwise, for kids that seem to have some issues, I'll have them like say, just put it in your water bottle at school and sip on it. It's totally okay. So we'll put a couple dropperfuls in there, a full water bottle. They'll sip on it throughout the day.
And what does it do for them? So like for those kids that take it in their water bottle and those people that are taking it every 15 minutes, what are their biggest takeaways as far as how it helps them? Is it inflammation? Is it pain? Is it like more the psychological distress?
Depends on what their herxing is. It could be all of the above. I've had it really be helpful for the neuro symptoms. Pain, whatever they're experiencing, like that healing response from treatment. That's usually a very effective way to manage that. Avia from Nutrimedics, if there is more of an anxiety like spin out, that's a really powerful one for that particular condition. So those are good.
Now, when it comes to supportive, like the Berber panella, the chlorella, the Avia, is there anything else that you recommend in that kind of categorization of that toolbox that we have?
Like immune support or detox, or which one?
Yep, immune support and detox. Yeah, I mean either or really, that more restorative,
Some people really find the binders are helpful, fulvic humic acid with either zeolite, GI detox, Z binder. I've had people use some of the zeolite sprays. I don't carry any of them here. I've mixed results. Some people are like, yes, those are the best thing I've ever used for detox. Other people really don't like them. So it's just not been something that I found a whole lot of consistent response with personally. And then as far as like if somebody's really struggling with like what we are considering like a compromised immune status or a histamine problem that is just kind of spun out of control, peptides that I really like to utilize are KPV and TA1 are fantastic. You can get those in a couple different ways. We can't get them injectably anymore, but well, TA1 you can, but not KPV. But they're just, are you familiar with peptides or?
Yes. Yep.
Okay,
Do
so
you mind? It's been probably, I don't know, 20 or so episodes since we've had somebody last describe it. Can you just
yeah,
give a general explanation of what a peptide is and how
sure.
it's used in the Lyme community?
Yeah. So I think of peptides as signalers. So they are, if you break it down to its most basic form, it's a Lego. It's an amino acid, so it's an individual. That's what a building block. So if you put two or more of those Lego blocks together, say glycine, leucine, whatever, that becomes a peptide. And you can do that up to 40, and then technically after that, it's a biologic protein. And there's a whole lot of FDA chitter chatter about what we can have and what we can't. But essentially, the way that they're connected. So if you think like, hey, I'm playing with Legos, I'm going to make a boat, a plane, a car, how they're arranged and in what form really outline their function. So that's kind of how I explain it to patients. Another way to really kind of conceptualize that is it's a conductor. So there's non-coherence in the system somewhere. And when you bring in these peptides, they're these signaling molecules, and they're, if you've heard a band or an orchestra play, that's a full windpipe, everything, strings, choir, and there's nobody at the helm directing that, it gets a little chaotic. But if you bring that conductor back into the center, things really start to work a little bit better. So that's how I describe peptides. There's these signaling molecules that are very powerful. They already exist in the body, so most people really tolerate them just fine. Again, I've had a few people that they don't. It just there's not a whole lot of consistency as to why. Or at least I haven't been able to figure that out. But yeah, they're a great tool.
I love that explanation. Thank you for that.
Hmm.
So quick, I want to circle back to peptides, but I want to
Hmm.
kind of go back to the immune support, the detox, but also, you mentioned the anxiety component and the mental health impacts of Lyme disease.
Hmm.
And we had interviewed an herbalist a few weeks ago from the UK. And I mean, it was unbelievable how affordable some of these products were. So I went on, and the shipping to the US was a flat rate. So I bought a whole bunch
Awesome.
of stuff. I bought different types of ashwagandha. I bought passion flower. I bought motherwort, right? And I've been playing with them. Like, okay, if I'm in a stressful environment and I can't sleep, which ones are going to work well? And
Hmm.
I was really surprised at how affordable they were, but also how effective they are. And I bought a lot of just calming ones because I'm looking for like when I need sleep help, what can it be?
Mm.
And if I don't sleep well and if I'm out somewhere else, or if I'm on vacation, or if I'm really stimulated and I get home late and then I can't shut my brain off, right? And these tools are really helpful. So what are
Hmm.
your thoughts about just recommending like generic? This was like Napier's, right? Napier's out of the UK.
Hmm.
And what are your thoughts on using these singular ones rather than like these blends, for specific purposes? Not only in my case, like I use it for more, calming and nervous system regulation, but even
Hmm.
antimicrobial herbs that they sell too, because they do sell a lot of antimicrobial herbs at Napier's at a really good rate. And I'm
Hmm.
curious what your thoughts are about that.
I don't know much about that particular brand, but when again, we're talking about Lyme patients who can be more sensitive versus stronger. So the people that I will geared more towards the individual herbs are going to be the ones that I'm like, okay, we've had a reaction, or you're not really sure you can deal with a blend, and we want to know if you have a response that's not great. We want to know what's causing that. So those are the populations that I'll gear more towards the single herbs. And I'm not an herbalist, but I use a lot of herbals here, but I can't claim to be one. So I'm not as familiar always with their individual as the broad spectrum that they're used for specifically. But I love cryptolepis, I love artemisinin. I think these are Japanese knotweed, and there are some arguments you can make for the more effective being used in blends because they're synergistically going to pivot off of one another. So I like that aspect if that's tolerable for the patient. But certainly if you're using them for a targeted approach and you feel comfortable doing that based on what your symptoms are, I say go ahead. Like I don't think, it's a you understand your body. Like if you want, I've had people say, "Hey, I tried valerian. I thought it was awesome." Great. I'm that's a great option. But it's just not something we use a lot, specifically for me with Lyme. So it's not something we always recommend. But if somebody, I will direct them like, "Hey, you might want to think about rhodiola in a higher dose on its own for depression. You might want to think about this. Here's where you can get it." So yeah, sometimes we will recommend those. L-theanine, I don't know if you've gotten into
Yep.
that. That's just like that is the ticket for a lot of patients.
Yes.
It's been a game changer. That's huge. And there's really like supposedly per the pharmacist that I learned this from, there's not really an adverse limit to that. Um,
Yeah, we actually, it's in the HPA Balance by Dr. Rolls, and it's also in the Mellow by Turnpaw. So Rich and I have tried both of those products, and those products, they're blends. So in those cases, they're more blended things together in the herbal capsule versus a tincture in an alcohol base. And those blends really work well for us too. Frankly, I mean, I think they're awesome, right? And L-theanine is really good. The HPA Balance by Rolls and the Mellow by Turnpaw are great. And I think you're right. We will have to just try. But I think it's important to note that it's not just an antimicrobial standpoint, it's a full body support. So everything you're describing, the detox, the emotional support, the sleep support, right? All those things are key to do in parallel to not just kill. Because you're just killing, you're probably going to get inflamed, you're going to flare, and you're not going to have a good outcome, in my opinion, if you just focus on that.
Yeah, so we also teach a lot of vagal nerve stimulation. We have some apps we direct people to. There's someone called Anxiety Release, which it's super old. It's not, it looks like the very old iPhone system, but it's like a ping pong ball, like ear to ear, and like your uh headphones. But it's this guy, and I usually don't like really thick accents, but his is very calming. So if you listen to it, it's supposed to be kind of triggering the left and the right hemisphere of the brain. You know, if there's an acute thing that somebody really is struggling with that they don't want to go into school, that's something that they could put on and do really easily. So those are you got to use whatever toolbox. I mean, this is complex. Sometimes it does require the kitchen sink. You know, we got to see how people respond. So, yeah.
Let's circle back to peptides, because I reflect back on a few years ago. We had a lot of people on this podcast, and at the time it was BPC 157, right? That was like the one. It was helping so many people in the Lyme community. It was helping them get over that hurdle. So, what are your thoughts on BPC 157 specifically? And also, if you can highlight some peptides that you use regularly, and you already touched on a few, but they use regularly, not only for, supporting the body and ridding Lyme, but also other areas of life in general that aren't even Lyme related that can benefit all of us listening in various parts of our life.
I would say that I honestly use peptides more for that supportive aspect anyway. When they first came out and you were able to get them like by injectables, Dr. Green and I both did like a full protocol that I think it was Kent Holtorf, if you've ever, I don't know if you talked to him.
We've interviewed him. Yes.
Yeah. So it was his kind of like established plan that he had, like, okay, let's try this. But it was, I'm not sure. Like, it was hard to know if there was a huge clinical benefit from a Lyme perspective. Was there benefit? Yes. But from that Lyme piece, maybe. I do have one person that did the full injectable plan, and that included TA1, TB4, BPC, LL37, Epitalion, which some of these you can't get anymore. But anyway, he believes, as once we finish treatment, I believe him that was what tied off his treatment. He's like, that did it for me. He's like, I haven't seen him since, so I'm assuming he's doing great. But I would say the ones I use most often are going to be that TA1. It's the very antiviral. Love it for that, increasing that Th1 subset of the cells. Really helpful for inflammation, autoimmune conditions. Obviously, you can put Lyme in there, but it helps with antioxidants and glutathione production and improving stress tolerance. It's probably when I have a really delicate patient that I'm like, I need to calm you down. That's the one I really reach for. TB4, I do use this, but I have some caution. I only use this one month on, 1 month off. So if we're going to do it, we're going to do equal times off. There is some data that would suggest it's not going to cause, say, a cancer cell to grow, but if you already have a pre-existing cancer, there is a potential, because it's proliferative, that it could propel that on. And that's unfortunately like a potential with anything, but specifically some of these peptides. But TB4 is really good for tendons or neurologic injury. I find that it's helpful. So not necessarily just for Lyme. Influenza, it does have some cardioprotective effects, I believe. I know it's been helpful for some liver issues, prevents LPS, lipopolysaccharides, from becoming too high. I do think that there is cytokine chilling of that particular peptide. Well, you guys all know all the weight loss injectables are technically peptides, as is insulin, but those are things that aren't necessarily in my wheelhouse for this conversation. Some of the nootropics, there are some nasal sprays that, again, not even just for Lyme, but for general memory, cognition. C-Link and C-Max are awesome.
C-Link and C-Max, is that what you said?
Okay. Yep. So C-Max is going to be really effective for anything involving the central nervous system. C-Link is going to...
Sorry, can you define nootropics? 'Cause I know we've had that on, but it's been a while since we defined that as well.
Sure. So it's going to have similar effectiveness to these nerve growth factors and stimulate the peripheral and central nervous system. Usually have some neuroprotective effects, helps with neural inflammation, block neurotoxins, improve stress or decrease stress, those types of things. So that's what I would kind of, all of that neurologic protection.
Yeah. And sorry, I interrupted you. I think you were going over CMAX and I interrupted you on that one. Yeah.
Yeah. No, so I use these more in like cognition. So if there's anxiety, some of these, I believe it's, oh man, I'm not sure if it's CMAX or C-Link, but one of them I use sometimes for sleep. Like if somebody has a real hard time falling asleep, that's a really helpful one. I think that's C-Link, and then CMAX is going to be more for the stimulation of the brain, cognition, memory, those types of benefits. I I do still have patients that use them. They are like, I can tell a huge difference if I don't use it.
Hmm.
So they don't use it all the time, but if there's like an acute thing that they really have to focus on, that's what they work on. I don't really use LL37 anymore. I know that was like a big hot one initially, like, oh, this is the antimicrobial. It's supposed to have a lot of effectiveness against biofilms. I just never really saw it. BPC, I do use this quite often, but I use it more in combination if there is compromised gut barrier and we're trying to repair. So it may be towards the end of treatment we bring that in. Somebody who has, some real bad nerve issues, I would probably use a little bit earlier in treatment, like neuropathy or paresthesias, numbness, tingling, those types of things. But that's just like an overall body protecting compound one. Good for injury, like if somebody's going in for surgery, that's an awesome. My father-in-law had back surgery this summer, and I put him on TB4 and BPC prior, and his surgeon was like, "What are you doing? You are healed." Like he was back in the gym in a couple weeks. Like prior, he couldn't walk hardly, really in a lot of pain, but he just feels awesome now. So I don't know.
Wow.
We can't compare, right? We can't clone him and have him do the surgery with the peptides and without. But that was really, really awesome. And he's like, I don't know what's in there, but he's like, I'm healing like, a champ. So that was cool. And also to get like an orthopedic surgeon being like, what are you doing?
Yeah. And,
Um,
and and that's a peptide though, right? BPC is a peptide.
yep.
And just to kind of zoom out for everybody listening, because these things can sound scary, right? You're describing, hey, they do all these wonderful things. And people might be thinking like, what are they that they do that kind of, assistance for our bodies? But really all the herbals you mentioned, including verbenipinella and chlorella, those are really just natural things that grow on the earth or in the ocean, right? They're things that we have proven that they are not toxic and they're supportive and beneficial to the human body. And they're things that people thousands of years ago did. And look, Otzi the Iceman had herbs like Japanese duckweed on his belt, and he was using it because he was infected with Lyme disease, right? So
and he had acupuncture points tattooed all over his body, so he was probably doing acupuncture as well. So
yep. So this is not new, but it's really helpful in treating these things. And peptides, to your point, are just really amino acids, right? They're naturally formed compounds in our body that we're giving ourselves additional quantities of to aid in the healing process or aid in some sort of deficiency we have in our body, right? So they're really not scary things. They're just giving our body support.
I think that there are ones that probably could be. Now, the ones that we have access to, I have not seen anything that I would consider frightening in any way. But when we're using these, I want to be sure, like, I think of it as like, okay, if you're sewing like a hole in your pants, like you're gonna eventually be done with that. So these peptides will reach a maximum effectiveness. Once they've repaired what they're doing, they've realigned the cells that they're doing that particular action on, you won't need them anymore. So it's not like I've not really kept anybody on this long term. It's more of like we're gonna try it for 2 to 3 months. Let's see then pull it off. And if you feel like there's a general decline, let's try it back. And if it helps, you still need it for a little while. But we really do test that out as we go.
Right. I think that's why people need to work with a partner like yourself or somebody who's a professional, because even with herbs and natural substances, you can eat a mushroom and die, right? They're toxic mushrooms.
You can drink water and die. So
right, exactly. So it's not like this is any more scary. As long as you work with a professional, these are tools that can be very helpful.
Yeah.
So you talked about IV therapies. What kind of IV therapy specifically do you offer or do you recommend for people in the community?
So one of our main ones that, again, if you're talking about detox, cellular support, phosphatidylcholine is awesome. That has been incredibly helpful because what you're trying to do is replace that phospholipid bilayer, the phosphate heads, with the obviously the EDHA fatty tails, but they're polar. They look like little jellyfish.
Obviously.
Obviously, they're polar as I make my hand movements. But if you could think of like little jellyfish with their tentacles touching, that's like what your cell membrane looks like. And what happens again when you have the cell danger response, it's a good paper. If you want to read it, you probably have. It almost makes that cellular membrane really, really hard. It becomes more like a marble than, flexible, allowing things in and out. And what can get trapped in there is good and bad things. So the choline I found is very effective if we really have somebody I use it as a pre-treatment if I have mold patients that I will utilize that in. Really, really sick people that, they come to me like, I can't tolerate anything. I'm like, okay, let's try this, a very, very low. So that's one of our most useful ones. We do a lot of just nutrient, I would say more bespoke, perhaps. Like I look at their blood work and we kind of come up with like maybe what they need, whether that's amino acids or B vitamins or vitamin C or N-acetylcysteine. It really kind of depends on what we're going for. Sometimes glutathione we will add in. We also do ozone therapy with UBI. I don't know if that's familiar to you.
Yes.
And then
On that, do you think that the combination of ozone with that UV light is really as effective as some claim? Because we've heard like mixed things, right? Like, oh, that ozone with the UV is just so much better than straight up ozone, right? And then of course ozone in different means for IV versus nasal versus, you hear anal, vaginal, and we've had people tell us all the different types of ozone. So, what are your thoughts on the different types of ozone plus IV, ozone plus the IV, right?
Well, I think
the
the
UV.
biggest cost with the consideration with ozone is cost and access, because obviously if you can do rectal ozone that does go systemic at home, it's A, cheaper, and B, you can do it at home. I don't do that in clinic here for obvious reasons. Like we've talked about it for a few patients with some really bad gut issues, but nobody's wanted to do it yet. So we just never have gotten there. The IV I do think is very powerful. Do I think there is no one thing. There is no one treatment that's gonna be the silver bullet. I wish there was. If I figure that out, I will call you right away.
Please do.
It's just not something I found. The one thing that I kind of alluded to it earlier. This isn't answering your ozone question, but I do think the light therapy is the thing. I I think that is extremely effective. I've talked about that a little bit maybe before you get on with the circadian health and sunlight and, getting off your computer as much as possible, blocking your eyes from the blue light as much as possible, because that signals different parts of your brain to suppress or produce different neurotransmitters,
Yes.
and hormones and all these things that control everything, including your immune status. So that is vital. Sunrise is vital. But getting back to the whole question you asked about
Right,
IV,
because the ozone essentially though it's ozone. Your blood gets mixed with ozone
ox
therapy, and then they run
O3,
it
yes. Yep.
O3, and then they run it through a UV
Light
light,
box.
which
Yep.
has an additional property of potentially being more cleansing and more antimicrobial. And I
Mm-hmm.
guess the question is, obviously you're a huge, light, supporter, but do you think that additional UV light after the ozone exposure does even more than
Yes,
just the
I do.
ozone to the blood and helps the patient? You know what I mean?
Yes, I do. I do think that there is an added benefit to that. We have not really had anybody when we do that here opt for one or the other. If they're going to do it, they're going to do both, and we've really had it tolerated extremely well with very positive response. The other aspect that we have as far as IV is coming like Thursday. We have our staff training for it. Is intravenous. Have you heard of the endolaser system?
No, what is that?
It's IV. Well, it's it's a wellness device used for topical treatment, but it's low level laser light. And so it's different spectrums: red, green, blue, yellow, UV, and infrared.
Hmm.
But it's something. Did you ever hear of UVLRX?
Yes.
Okay, so it's similar to that. So we had that here. Dr. Green had it when they first started. That was probably the most effective thing we had. It cut the recidivism, meaning recurrence rate of patients coming back with additional symptoms significantly. And I wish I had data. I do. It's in a box somewhere. I don't have it right off the top of my head. But it also sped up treatment. So the
Hmm.
length of people having to do either long-term herbals or antimicrobials or XYZ was really much diminished. But the endolaser is an FDA-approved device for topical use, but there is an off-label use for intravenous. So that is what we will be doing training on this week. and I'm
Can you describe that? 'Cause
excited.
I think it's a really fascinating concept of IV light. Can you just describe for our listeners like what that actually means, right? Because
Yeah,
I've seen all kinds of cool videos of people having the IV and the light and the different colors. But can you describe that? Because you're so good at explaining things. I want people to hear how you explain that.
sure. So everybody's probably seen an IV or had a blood draw, so you know that there is a metal needle that you're inserting with a plastic catheter. The plastic piece stays in. So instead of hooking you straight up to a solution, either with medication or nutrients or whatever cocktail of immune support we have in this bag, or ozone for that matter with the blood product, we actually just thread in a zero point 0.5 millimeter fiber optic cable, which is like a baby flashlight, and it just sits and nestled in the vein as your blood flows by, because when you have this external light box, right, you have to let that flow naturally through gravity back into the body. Well, you have this heart right here, which is a natural pump, so you're going to be getting much more exposure, um, of your blood circulates in your body very quickly, so you're going to get more exposure of the light to the blood. So that's the idea, and the different, it's really cool.
Yeah, I'm a huge fan of that as well. Do you know Greg Lee? Because he did
I don't.
a whole bunch of talks for us. And I know Rich brought him up to you already, but Greg Lee is a huge advocate of light therapy. And he even did a really cool Lyme hack for us last year where he came on with all these like different light devices and just talked about it. I mean, he's
Mhm.
really doing some cool stuff. You should check him out. I think you'd love him and be able to collaborate. He has data as well and treats people in his
Greg Lee.
community. Yep, Greglee. Yeah,
Okay, cool.
yeah, he's
Thanks.
another great resource. So an additional follow-up, when you were talking about the cell danger response, every time I hear that word, because Dr. Kathleen King introduced us to that from Primal
Mhm.
Trust. So you're familiar with her work as well? Can you touch on earlier the the neuroplasticity side by just watching like that old school iPhone-based YouTube video, right? But Kathleen King has a neuroplasticity program similar to DNRS. And
Mhm.
she's a huge advocate of that. And she's been wildly successful, frankly. And most people recommend her as well. So I'm just curious, in the neuroplasticity realm, is that something you've looked into? And if so, what are your thoughts about the other players out there in that space?
No, it's not. I wish I could tell you. I've got a lot of experience with that, and it's not my area that I've looked
Okay.
into in depth. So I wish I had more, but I
Yeah,
don't.
no. So I very much appreciate your honesty there. And then another follow up, you talked about like really damaged guts earlier, and
Yeah.
that made me think about we had other people come on and tell us about fecal implants, right? And
Mm,
it scares, no pun intended, it scares the crap out of me because
yeah.
the some people tell us like, hey, I felt amazing and that was the thing that got me better. My gut was destroyed. I was sick. I couldn't eat anything and now I feel normal again. Other people say, oh my goodness, my personality changed, right? Because your
Oh,
gut
wow.
microbiome is so critical and the gut brain axis is so key. And we're learning more and more about that these
Hmm.
fecal implants are putting an abundance of microbes into you from somebody else that can have a direct impact on your emotions and your personality. So, I'm curious what your thoughts are in that area because a lot of people in the Lyme community think about it, and I don't frankly know where I stand other than I think it's risky.
I think that if there is no other option and somebody is really struggling with some gut disturbance, say post long-term antibiotics, et cetera, it's a consideration, but that needs to be done with a lot of informed consent. Like these are the things that could happen. I have had patients fail it where it didn't work at all. So I guess that is expensive to do with not a guarantee. And I guess there is no guarantee with anything. But when you're talking about like literally ingesting fecal matter, that's hard. That's a hard sell, I think, for
Yeah.
people. I guess I've not really gotten to the point in my practice where I felt that I needed to recommend that on a routine
Yeah.
basis. The person that did do it, she did it on her own. And then I had seen her afterwards, and that's why she was seeing me, is because we
Mhm.
were struggling after that didn't do what she was hoping. Um, so as far as the personality change, I don't know if I've seen data or any literature on that, but I guess I also haven't looked that much because it's not a treatment that I'm going to be exploring here personally. Like that would be something I'd refer out. But that's very interesting. I think that's certainly possible. Um,
Yeah, we've interviewed a lot of people. Well, I shouldn't say a lot. We've probably interviewed a dozen people who have taken it, and again, it's been mixed feedback, right? Like it's been a
mm,
game changer and a lifesaver versus I'm a different person because of it versus it did nothing or I got worse. It's such a wide spectrum. So I was like, little risky there, right?
yeah.
The additional thing you mentioned earlier is earlier you were talking about the lymph, right? And I think it's
Hmm.
important, and I know I'm putting you on the spot, and I'm sorry to make
Yeah.
you, but you are really good at explaining things that are hard to understand, right? And I
Oh,
think
well,
for
thank
us,
you. I try.
no, really good. And the lymph seems like such a common concept, but before I got sick, I didn't understand what the lymph even was. So can you just explain to people that are listening, like, what is the lymphatic system and why is it important for people who are chronically ill, like with Lyme disease?
Oh yeah. So I think of the lymphatic system as the garbage transport waste system of your body. It really is crucial in fluid regulation and balance. Critical also for immune function. So what we offer here, my practice manager, tell you she does everything. She also got certified in lymphatic drainage. She's one of 3 people in the state that actually did the proper certification. There's really only one. I don't know. I'll get into that later, but it is effective in helping with obviously a stuck system. So if somebody's really not detoxing, I had a guy came in constipate like would have a bowel movement once every 7 days.
Oh my goodness.
He I was like, okay, we need to throw everything at this. And I was like, you need to try lymphatic massage. And Kate will teach people to do their own abdominal massage to kind of get things moving. So, like, if they can't come in on a routine basis, at least they can do the lymphatic stimulation on themselves, and then they can do it on babies too, if there's constipation. But he had to stop 3 times on the way home because he had to go to the bathroom. That's how effective it was.
That is insane.
So it's extremely helpful. We've used it a lot in kids, like, who maybe won't take XYZ things for detox. They can come in, do a quick 20-minute little skin brush. And that's what it is. It's a very light touch. It's not like a traditional massage. Um, Certainly seen behavior changes in kids, more calm, less
Really,
fluid.
behavior changes.
Yep.
What interesting.
Yeah. So if they're, and I would not necessarily attribute that like a direct effect, but when you're talking about like, hey, if they're having, um, say neuroinflammation from whatever thing we're dealing with and we get that kind of starting to move, that's where you see that improvement. So,
Yeah, I mean, what are your thoughts on so, one of the things that I never thought would be so helpful for me is, and I guess it's a double-edged sword. And I want to get your feedback on this. So
yeah.
I love well, when I first was really sick, I got a massage and it made me feel so much worse, right? I went with my mother and my grandmother. I was really sick. I wasn't even, clear to drive because I was so neurologically impaired. I got a massage and I'm like, oh man, it sent me back for weeks. My pain was worse. I was more neurological. It was insane. And then I was afraid, honestly. Now I'm at a place where like I'll just whatever, right? So I go to Planet Fitness, a local gym, and Rich knows this, but they have this hydro massager, and you can go on it for like 10-minute increments. And I go on sometimes a couple of times for 10-minute goes, and it's just the most relaxing, calm thing. And when you said it, like it's like a calming thing, I'm like, wow, like I just feel so
Mm-hmm.
like just chill afterwards. Like I can, it's amazing, right? And then I'll go in like they have the massage chair, and if I put it up to the highest setting, I'll be a little sore. Right. But I think we got to be careful for people who are really unwell versus depending on where you are in your journey. It can be
Mm-hmm.
triggering if you go too hard with like a
Oh
high
yeah.
pressure hydro massage or a high pressure even massage like I did when I was early on at an actual masseuse, right? So can you speak to that, like the benefits, but also the risk depending on where you're at,
Yeah, I think that what you're doing a lot with those types of modalities is going to be improving supposedly detox. But if you are doing that too quickly, that could be very overwhelming. Like if you're mobilizing some of these toxins to be released and your system can't keep up, it's like, okay, it's kind of like this whole airplane, or the drinking analogy where you have so many airplanes, you have so many drinks, you can't get rid of them as quickly as you are mobilizing. So it's that same idea. This brings to mind, sauna is something I absolutely recommend for detox. But again, we had a lady, she's been treating elsewhere for a long time. I saw her second follow-up this week and she's like, yeah, I had to stop sauning. It made me feel worse. But
really?
but she was she's kind of like full on all the time. If you tell her to do this, she's going to do it. Um, so she was doing about 45 minutes full every day. And I was like, well, are you replacing electrolytes? And she's
Yeah.
like, well, not really. And so I'm like, well, let's have you start that. And then we're going to start back at 10 minutes and see how you do one day at a lower temperature. So those are things that you have to be very careful for kind of overdoing it in the sense of mobilizing some of those toxins and then your body just can't keep up right at that moment because
Yep.
if you have fighting too many battles on too many fronts, you're going to lose. So you have to kind of
Right.
figure
Yeah,
that out.
essentially these toxins are embedded in your tissue. They're stagnant in your lymph. And if you're
Mhm.
mobilizing these toxins, they are inflammatory until they're purged. And if you're not detoxing properly to pee them out, poop them out, sweat them out, et cetera, and you're
Oh,
not
yeah,
moving,
exactly.
you could become even more toxic and more symptomatic. And I think that's what happened to me, right? And I
Yeah,
think that's the
it's
balance.
mobilized.
Yeah.
Exactly. Yep. It comes out of storage and then you're like, oh yeah, whoops.
Yeah, so I'm going to ask you, well, one final question before Rich picks back up. So really it's an ask and a question. My first ask is every May in Lyme Disease Awareness Month, this is our 6th year we're going to be doing our Lyme Hackathon. It's one of our it is our most successful initiative, second to this podcast, and it gets millions of views every year. You are just so good at explaining things. I'm going to call you out publicly on this interview and say, please do a Lyme hack, which you're going to get an email just asking you to do that. So that's more of a beg than an ask, right?
I don't know what it means, but I think
basically some
I don't
tips
feel
for the
like I
Lyme
can
community.
say no.
Yes. Then you're going to kill it. And then the second question I have is,
Sure.
if you and I ran into each other in the grocery store and you found out that I had Lyme disease and you knew that I was struggling and I just had fatigue, I had some pain, and I just felt discouraged, what would be the singular piece of advice you gave me in passing while we were walking through the, I don't know, the almond milk section of the grocery store?
Oh gosh, I wish there was just one thing, but what I would are you asking what I would tell you to do, or what can I tell you about Lyme? Because those are kind of different questions.
What I can do to turn around and start making progress in my healing journey. I'm stuck, right? And I need help, and I'm looking for guidance.
If you asked me this a year ago, I'd say nutrition. But since I've been digging into the circadian quantum research the last year, this is where I think the focus needs to be. I think if you are going to prioritize, you need to prioritize your light environment. Hands down, that is the number one thing. I will I might be the only one dying on this hill right now, but I'm going to sit there alone until everybody comes to meet me. You need to be seeing sunrise every single day. You need to keep your light environment very bright during the day, very dim at night. You need to be seeking sun breaks. If you are indoors a lot during the day, you need to be going outside. Because what happens when you become sick and ill, and I'm sure that this is reflected in a lot of people's experience, you put yourself in your room, you stay on the computers, you stay on screens, you don't go outside, you don't interact, you really isolate yourself. So you don't get that outside light. That is very healing to your eyes and and ultimately your brain. And that controls all of your immune status in your body, I believe. So when we're talking about mitochondrial health and cellular health and those things, you can't do it without optimizing your light environment. So sunrise every single day, taking sun breaks frequently. I mean, I do this. Like I pride myself in my practice, and if I tell my patients to do something, I'm doing it. So this is something that I have changed my habits. I go and take the dogs for a walk, see the sunrise every morning. I try, at least weather permitting, get outside for lunch every day, at least for 10 minutes to take a break, see the sun. Keep my lights dim. I wear my blue blocking glasses. I will shout out my lady, Kelly Bento at Soleil. Well, she has the best ones for the most affordable price.
Are they really real? People come on this podcast, say blue light is fake and it's all psychosomatic, but I don't agree. So I'm looking for your feedback here.
No,
okay, good.
Blue light is toxic to your pituitary hypothalamus, and it will dysregulate your entire system. When you're talking about neuroplasticity and I mean, I guess maybe that's where I would be an expert, or maybe have some thing to add to that conversation. But that is the thing. Like I used to think like it was a thing. And no, it is the thing. Like if you are not prioritizing your light, you are really doing yourself a disservice. So computers, they're ingrained in our lives. We use cell phones. You have a computer in your car now. You can't get away from it. On the blue light on your dashboard. It's on sometimes on your refrigerators. I don't know. I couldn't get a washing machine without Wi-Fi. I had to pay extra. It's crazy. But anyway, blue blockers after sunset. There is an affiliate we have with my circadian app, which is the only app I use. It gives you signals that are reminders of this is it's daybreak, sunrise. This is solar noon, get outside. You can make vitamin D right now, get outside, wear your blue blockers, those types of things. But that is, if I have to say one piece of advice to somebody, that is it. That's good right now. That's going to be it.
I think that's really exciting. I mean, as it turns out, one of the podcasts I follow is Dr. Andrew Huberman.
Yeah.
He has his 7 pillars. I'm looking at of physical health, and pillar number 2 is sunlight, light exposure, and dark exposure.
Should be number 1, but
And well, and
I like that it's on there.
I'll let you debate with Professor Huberman about
no problem. I'd be happy to.
He is a huge advocate of
yes.
and I actually I can just share with you that since I've been following his podcast, I get up every morning and I look at the sun as it's coming up for 2 minutes.
But you take your glasses off, right?
Yes, and actually I actually make sure that the window is down as well, that I'm not looking through the glass.
Perfect.
And I also, other than today, I make sure that I go out and watch the sunset for 2 minutes. But because we were being given so much enjoyable information from you. I missed that today.
I
But
know it's cloudy here,
yes, light exposure is I think very, very important. It certainly has been very powerful for me in in establishing my sleep patterns and having a
oh,
healthy
huge,
uh,
huge.
patterns. So yeah, awesome, awesome
Yeah.
that you're very much in line with Professor Huberman and Professor Walker.
Yeah,
Yeah.
I think that is just I don't know. I was as a sports nutritionist, like I was on the I will die on the hill of nutrition every day, and I have patients that eat perfect and they do everything. And then I'm like, well, why are we still so symptomatic? Like you're doing everything right. And then when we reflect on what their light diet is, what their consumption of technology is, and they're like, oh well, I get up, I use my phone, I don't go outside, I work from home, I have 5 screens. Those are the things that if we can modify that, I think we will do so much better. Because what's really changed in the last 30 years is the integration of technology and screens into our world. We can't get rid of them. We just want to use them really safely.
I mean, it's one of the things. I mean, there have been many things that I think have changed over the last 30 years. The quality of our food, as a sports nutritionist, in the is
Man-made toxins too, right?
radically
Hundreds,
changed. I
hundreds of
mean,
thousands of them.
Yeah,
yeah,
but if you have cellular health,
plastics.
there should be some more
Sure.
ability to manage those easier. And if we have the poorly functioning cells because of light toxicity, there's a problem. So anyway,
Yeah.
but yes, I do
So
think those are very important things.
you've been very kind to spend so much time with us, and we are at the end of our time together. So
Hmm.
thank you so much for taking time away from your family, from your practice, and sharing all of these brilliant insights with the folks here at Tick Boot Camp.
All right. Well, thank you for having me. Good to meet you both. Okay. Good night.